Welcome to the Stress Free Dentist podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches, or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD. All right, everyone, welcome back to another episode. And today we are joined by Dr. Sam Shamardi. He's a periodontist. He's an author. He's faculty over at a little place called Harvard University Dental School. He's very involved with a lot of things. He's an entrepreneur. He's the founder of an awesome implant and surgery program called Master Clinical Surgery. And he's got a lot to offer. So it's going to be a great episode. Dr. Sam Shamardi, thanks for joining us.
Thank you. Happy to be here.
Yeah, Sam, let's dive into how did you even decide to become a dentist and then ultimately a periodontist?
Sure. I mean, dental-wise, not to sound cliche, but ultimately, I think the interest was ability to help people. I think the big thing was for me that caught me was the preventative side. I think the reality once we get into the field is we realize maybe it's not as preventative as we think, but that was back in undergrad what kind of was the appeal. And for me, perio, I need the variety. So if I wasn't a general dentist doing at least different procedures all day within the specialties, there's a good 7, 8 different kind of surgical procedures within perio. So I felt like, you get the variety, and ultimately that's the specialty that has the biggest impact on the overall systemic link. I think before it really wasn't talked about much, and now people have realized, how major it is, and everything between Alzheimer's and diabetes and cardiovascular, and we literally, excuse the pun, but have a lot of impact in our hands when it comes with that perio and systemic link. So those two things really, drew me more to perio compared to any of the other specialties.
And where did you go to dental school and your perio program?
Yeah, so I did dental out here in Boston at Tufts, not too far away from obviously where you are, and perio I did at UPenn in Philly.
Okay. And after UPenn, for a periodontist, I'm a general dentist, but I love, having a good variety of dentists on and different specialties. What did you do after your perio program? Did you go and associate? Did you open up your own practice? Are you a traveling periodontist? What's your story there?
Yeah, it's a great question, and it's something that always speaking with the residents and speaking about, because as a specialist, especially perio, the field has changed quite a bit. I think, generally speaking, obviously with all the DSOs and just kind of the multi-specialty, things have shifted a lot. I think the days of mom and pop, especially in cities, I wouldn't say it's not there anymore, but from a perio standpoint, it's definitely not similar to what it was before. And of course, a lot of people are doing a lot more of their own surgery, which is part of the motivation for the course. But I was always more of the traveler, being an independent contractor, being interested in being involved in academia and being on the speaking circuit, and from the entrepreneur side, working, on other products and bringing things to the industry, to have that kind of, multi interest type of background, and then also trying to manage a practice, that being a specialty one, just didn't seem like it'd be the most feasible from a practicality and work-life standpoint. So for me, it's always been more from the independent contractor side, and like anything else, pro con, I think it's been great in terms of I've worked East Coast and West, DSO, private practice, specialty only, perio pros, multidisciplinary. I've kind of had my foot in a lot of different practices over the years, so it's given me quite a bit of exposure and insight, and that's been another big kind of key, not only just from a practice standpoint, but from a speaking and teaching standpoint. I'm able to bring in experience from a lot of different areas and be able to speak to it directly, which really makes a big difference.
Are you seeing more of a trend in periodontists when they get out that they're not just opening up their own shop, like you mentioned, they're doing more what you're doing, and they're an independent contractor going to several different offices?
Yeah, I do think that's a bigger trend, especially in cities. I think, if you live in a more sparsely populated area in a suburb or, something like that, you most certainly can have your own practice and thrive and, be great. But I think if you are more in a city basis, it's definitely become more of a challenge. And then again, I think you also have to look at your interests. Like I said, from mine, having some of those other interests, then trying to combine that with also doing the practice, isn't as practical as if, you're head down full speed, clinical side only.
And now, actually, when I did a implant residency at BU, this is
Hmm.
back in '02 to '04, and I was a general dentist and working as a general dentist in two or three offices, but I was also this traveling implant dude, and I went around to different offices, and I think it was actually up to five at one point, and I would do the surgery and if they wanted the prosthetics as well. A lot of pros and cons. I felt more cons because I just wasn't in control
Yeah.
with the inventory. The staff was often different, supplies, the schedule. So I imagine, is that one of the downsides of being an independent contractor?
Yeah, I think when you're independent, especially nowadays in terms of more of the DSO, certainly in that type of environment, as far as autonomy goes, you have a lot less. I do think comparing being a specialist versus not, I do think as a specialist, I have a lot more autonomy than if I wasn't. So in terms of like you mentioned, the supplies and some of the scheduling stuff, I think from that standpoint. I'm there to help guide, hey, how are we scheduling things and what's our setup going to be and what are the type of, materials we want and whatnot. Certainly for the specific implant brand, I mean, that's something you would work with what the practice uses or what the restorative doc is comfortable with. And from that standpoint, I think you have to be a little bit flexible. So it's certainly not kind of 100% in your hands for everything, but I do think as a specialist, I think you do have a little bit more, or I should say probably more autonomy than if you weren't.
Yeah, I think at some point I just brought all my own stuff. I just like wheeled around a suitcase and
Yeah.
just showed up like I was going to the airport with a giant suitcase.
That's
Um,
totally what it is. Totally what it
yeah,
is. And again, that's kind of the hassle and what you get tired of. But then other people look from the other side and say, well, when it's 5 o'clock and when you go home, you just pack your bag and go, and you're not sitting around late nights to deal with paperwork and HR and management, all that type of stuff. So again, there's like anything else out there, there's always a pro and a con.
all right, let's get into your program here, your course. Is it called Master Clinical Surgery? Is that the name of the course?
Yeah, so well, that's the name of the website. Basically, mirrors the name of the course as well. Just the overall theme is mastering surgical cases with confidence, and really the big part around it is being somebody that's been speaking on around the country now for over a decade and plus at conferences, et cetera. We notice a big change in terms of training courses are always very valuable. But the reality is, and this is no different if I go to a CE, I mean, there's only so much you can retain. There's only so many pearls you're going to take from you. And usually once you get back to work the next week, you're trying to remember, hey, what was that technique? Or like, what was that instrument or how they do it? and you just don't have that reinforcement. You don't have that community. You don't have that ability to, share questions and cases and be able to have that level of kind of mentorship. And so that's part of the big motivation. I think, ultimately with the amount of surgery that general practitioners are doing now, considerable more of, whether it's implants or other type of perio procedures. I think, being somebody that's been helping, train and educate that bigger community, you see the importance of not just giving them the training, but really the missing piece is the mentorship, the coaching side. So what makes this program unique is more than just sitting there and telling you, here's something that you should do and how you should do it or why, but it's really going into, pitfalls. Hey, from my experience as a specialist doing this day in, day out for, 15 plus years, here's the situations that are going to come up and here's what you can expect to see and here's what you need to, avoid. Here's a pitfall. Here's, best practices. Here's instruments that are going to make a huge difference. And, you introduce an instrument that they haven't heard of or seen, and suddenly you see a light bulb go off where it's like, holy cow, that's going to help me do this procedure so much easier than I was before. And ultimately, again, it's about bringing that type of approach, but doing it from a standpoint where now what's unique about my program is that you're going to have, web-based lessons that not only you're going to be able to be educated on, but now with it being on a platform rather than it being like a training course where, like I said, you go home and that's the end of it. Now you have it at your, palm of your hands, access to it at any point you want. Before a case, if you're trying to remember a certain thing, you could always go back and reference it. So you have this ability to have an ongoing kind of education. You can submit cases and we do, case review and reach out. So not only is there a constant kind of, reinforcement of the education, but now you're in more of this mentorship group and you're among a small group of kind of like-minded colleagues. So everybody's in the same boat. And then that's the other big thing. At a course, people are uncomfortable to raise their hand. I'll ask people questions and nobody wants to be the one to say it because they feel self-conscious or, what if they say something and they're judged? But once they're among a group of people that are similarly motivated and going after the same thing and asking the same and coming across these same situations, now you are able to be comfortable, open up, ask the type of questions, get the reinforcement you want. And again, I think that's something that makes this really unique.
Yeah, it sounds like the opposite of a lot of courses I used to go to, where these presenters would show this like amazing work and show this amazing stuff, and then I'd leave feeling worse and
Right.
feeling like like I'm doing like unsatisfactory dentistry and feeling bad. Like, so
Yeah.
this sounds like I love the fact that there's a mentorship, there's a community, and you're right. It's when you're learning implants or surgery, you're working on a live human being there, and
Right.
you need to get trained and educated and take things slow. Are your students, are they GPs? Are they
Mhm.
fresh out of school?
Mhm.
What are you seeing there?
Yeah, it's a great question. I think ultimately, the base for this is a clinician that has started or has been doing surgery and is really kind of looking to elevate to that next step. So I think a program for somebody that has never done an implant or a surgery and is just starting out, doing that is not what this program is. This is more, hey, you've gotten your feet wet, you're doing more involved cases, and you're really kind of looking again to take that next step up. And again, I think you hit the nail where going and presenting some elaborate, really, intense case, that's not going to necessarily be something that people are doing day to day. So they're wanting to see the more practical clinical situations, the things that they're going to be coming across more often, and to have, straightforward, predictable, and, really structured methods to doing it. So we have, two different setups in place. One is a much more extensive 6-month program where you name everything from, diagnosis to all the different phases of surgery, resective, regenerative, implants, going over actual how to manage complications. That's a huge thing that gets overlooked. What's the point of learning how to place if you have no idea how to manage the complications, which you will guaranteed get? And the long-term maintenance. So it's a very comprehensive A to Z type of program, and that's the 6 month. But in addition to that, the separate program, which is a very specific, focused 3 month accelerator, specifically on the topic of atraumatic surgical extractions and ridge preservation. So this is really the bare fundamental in terms of the bread and butter of what you're doing on a daily basis in terms of extracting teeth, trying to preserve and maintain as much of the socket as possible, set yourself up for success for implants or Pontics for bridges. And again, these are the types of cases that, it's not a question of not knowing how to extract a tooth. We've all done it, but ultimately, at the end of the day, everybody's come across those cases and situations where they run into a situation, whether it's a difficult patient or a sinus exposure or maybe a wall of bone missing, and they're wondering like, could I do this differently, or is there another way, or is there a technique that would have made me get a better result and do this better and differently? And again, these are the kind of questions that we all have, and we always are too uncomfortable and don't have a place to get it answered. And you're not going to get that answered in a training course. You're just going to sit and listen to somebody show how they do stuff, but they're not necessarily answering and targeting your needs. And that's really what it comes down to, because each of us are going to have different needs and situations and things that we're looking for. And again, that's what makes this different and really targets the individual clinician. So it's great that we got both of those, like a 3 month accelerator on a very focused topic. And for those who are looking for kind of a broader, more overall thing, we have the 6 month offering as well.
And is there any like one-on-one live surgery type of learning?
So this one, because it's web-based, is more of again of a coaching mentorship approach. So there's definitely didactic stuff. There's lessons I'll be showing, cases, literature, again, all of kind of the technique and whatnot. In addition to that, there is a case submission portal. So depending on what topic we're covering, you'd be able to submit a case that you have that you really want to, get feedback on and get the, approach in terms of, hey, how would I approach this and what are some, tips and whatnot. So you're going to get that kind of individual feedback from that standpoint. And then especially again, with even the bigger 6 month program, there is a live event that we'll have, which will be an in-person weekend. And we're breaking that up between a day of didactic, where we're covering, again, surgery, but also some other really important overlooked topics in terms of, how we close cases and how we sell these cases to our patient. And by sell, it's really more, how are you explaining it for it to make sense to them, for them to then have confidence in what you're going to do and want to move forward with it. And then also a second day, that's more of a hands-on approach, where then again, we can sit there with, whether it's pig jaw or tight bones, whatever it is, on these different hands-on approaches and really get our hands wet in terms of the materials and some of the techniques we reviewed. And that will be really significant, because once you've gone through the program and you've been exposed and you've tried some of these things in practice, we can really kind of elevate that in person and get more of that one-on-one there. And then from there, you're really kind of popping things off and really off to the races from there.
And tell me about your book. What's the name of your book?
Yeah, the book is the Financial Survival Guide for Dentists. So that was kind of a passion project actually during COVID. It's something I wanted to publish for many years, just didn't have the time with being full-time in clinic and the academic stuff. But once we had that slowdown in COVID, it was like, man, what am I going to do? And, one day it was like, hey, this is the perfect time for me to try and do this if we're sitting around anyway. So, motivation behind that, and you can relate, I'm sure, like all of us, is, we go to dental school, we learn dentistry to the extent we can, but we learn nothing about the actual finance stuff. We have no idea about our student loans. We have no clue about insurance, the differences between them, what's a corporation, what's a write-off, What's the interest rates? What kind of riders do I need in my disability in case I get hurt? And retirement, savings. What do we need to do? How do we, prep ourselves for later in our career? I mean, these things are actually, ironically, as you start practicing, our biggest challenge and our actually most important level of success. The question is always like, can we retire? When can we retire? What do we need to do to kind of make sure we're protected? And how can we be most efficient with our time and our money and how we do things? And again, these things are sadly just never addressed in dental school. But so that's what the basis of that book was. So kind of go through all those topics and more, and really just provide, especially the new grad, although everybody benefits from it, but really give them a roadmap that they can look at, and again, just have a foundation, and that's really what it's about. Have a foundation, and then it gives you that kind of start that you need, and that we simply just didn't have.
That's great, man. That was a very similar story to me during COVID is when I started, the stress-free dentist brand and book and all that stuff. So,
Yep. Yep.
very similar. I had the time and I knew I wanted to get some things done and finally made it happen. All right, Sam, let's wrap up with two final questions. One, how do we find out more about what you're up to regarding the courses, the book, the program, all that stuff? And then number two, what advice would you give to the young dentists out there?
Cool. Well, as far as finding out more info, again, the website for the courses you can look up is www.masterclinicalsurgery.com. That would be the best place to look up information on that, and apply, get on that wait list, and get in contact with you and get everything set up there. Also, via social media would just be in Instagram at Dr. Sam Shamardi. Pretty straightforward for that one. So those would be the best places to connect directly. As far as questions or advice, I should say, for a young dentist, I think, honestly, motivation for this, I think number one is find a mentor. And that could be a mentor for your clinical side. That could be a mentor for your financial. It could be obviously more than one. The more, the better. I mean, ultimately, you want to connect with people who are in a position that you foresee wanting to be yourself. And that, varies person to person in terms of, if you want to own a practice or be independent and a certain lifestyle or a certain style of work or whatever it might be. But, find an individual or two that, kind of match that, and, seek their advice, ask how they did it, and go after that. So that would be probably the biggest. And then the second thing I would say, piggybacking off the finance side, is start as early as you can, just saving. And, I stress this to the residents. We have a thought of, God, I got student loans and I'm renting an apartment. I'm doing all this stuff like off the bat. I just don't have the money to afford it. But they don't realize that even $100 a month, even though it sounds like nothing, it creates healthy habits. It gets the process started. And again, that stuff, that type of money you put away starts to compound and actually accumulate a lot more than you think. And the earlier you start, and there's just tons of financial breakdowns of this, the earlier you start, the more you're able to build at a quicker rate. So, waiting 10 years later because you feel like, okay, I'm in a better economic position then, the logic makes sense, but the math of how it works out actually doesn't. So you're better, even if it's a tiny bit, starting off earlier, but doing that than waiting longer. So those would probably be the two biggest things I'd say.
Oh man, great stuff. Dr. Sam Shamardi, thanks for joining us. Amazing episode.
Thank you. Appreciate having me.
Thanks again for listening to the Stress-Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress-Free Dentist.